Um, I'm with the Sickle Cell Association of Texas Mark Thomas Foundation, and for the last 6 years I've been a nurse in charge of the medical unit for the camps organized by the association. I care for about 50 children in the summer for a week-long camp, and about 25 teens to adulthood. We do a transition program. I'm also a mother of a 12-year-old daughter with sickle cell. I wanted to speak today about why I feel it's so important that both these bills get passed. When my daughter was 8 years old, she had a severe sickle cell pain episode where we live in a rural area, so we had to go to an emergency room. And when we got there, we waited for hours with her in pain. And once we got to the back, another couple hours before the doctor came and saw us, and he refused to touch my daughter. He stood in the doorway and told me that my daughter was seeking drugs, and that he was just going to give her one dose of pain medication and send her home. Of all the kids that I take care of, over the years, I've come across a few experiences that they've told me where 3 different times where people have told me they have broken bones. Like, children have broken their arm, one crushed his foot, and they went days without treatment because they're so used to that such severe pain that they didn't even recognize, and their parents didn't recognize that they had broken and crushed bones. I'm sorry. So like the different types of pain, there are 3 different types of pain that someone with sickle cell can have. An occlusive acute pain episode, they have chronic pain, and then neuropathic or nerve pain. An acute pain episode is mainly where people get hospitalized. It's where the blood vessel gets blocked and a piece of their body dies. Like in a heart attack or in a stroke, a piece of you is starting to die and you get immediate care. You get immediately taken back in an emergency room or in a hospital and get immediate treatment, because we know that when that occurs, the faster you treat, the faster you care, the faster you medicate, the better the outcome for the patient. And because of the stigma and the pushback on pain medication, people with sickle cell are waiting hours, days even, for the proper treatment. So passing this bill would be a leap in the right direction, a giant leap in the right direction to acknowledging the level of pain that people with sickle cell experience and getting them the proper care and treatment that they need.
We have a colleague with you.
Okay. Yeah. Thank you for your time.
You are so much welcome.
Chairwoman Thomas and members of the Public Health Committee, it is an honor to speak before you today. Thank you, Representative Jarvis Johnson, for your support and shining light in these issues.